really need to get people comfortable in the kitchen again. Like less DoorDash, more cooking.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, what's up, Hadar? I've just been thinking, as we spend more time learning about HS, doesn't that get into your dreams as well? Just thinking about how we can do better?
Yes. I mean, I think it's a little TMI, but yes, I do often think about HS. And today, actually, we're going to talk about two of my favorite things.
Hey, wait a minute. Hadar, aren't you the El Presidente for the HS Foundation?
Yes, but it's all al dente right now. So I'm yes, but it is true. The HS Foundation is the largest nonprofit, really trying to make a world where people don't suffer from HS, kind of driving that mission robustly. And I'm privileged to be part of that organization for a little more. But today we talk about HS today, which is my favorite topic ever. But we are combining it with my even more favorite topic, which if you've been listening to any episode, it probably came through, or if you met me, it's food. And we're talking about food, yes. So we're talking about food and HS, and we have two excellent guests who actually bring so much more dimension to our discussion than the usual. So I'll let Raja introduce our guest.
Oh my gosh, what a cool session we're going to have today. So we've got Cristina Curp, who was diagnosed with HS and has spent her life just, dealing with a lot of this from the patient perspective. And I think that this is going to be really interesting. But she's also got this journey with nutrition to better manage everything. And so she's got 2 best-selling cookbooks. So we are super excited, and she's joined the team, the HS Connect team, which all of you should know about. HS Connect does a lot of advocacy. So that's going to be really interesting. And then not only that, we've got another person here that's going to help us, Jillian.
It's a twofer.
It's a twofer, right? I mean, for me, that's definitely a dream come true. That's what I dream about, twofers. So Jillian Ondreyka, she is a dietitian with over 10 years of experience in working with clients and helping them get to their nutritional goals. She also, at a personal level, has HS. And so we're talking to people that aren't just going to be theoretically talking about how we approach this, but you have one person that's got a wealth of knowledge, been in the space of nutrition, and we also have a dietitian. So Jillian and Cristina, we are super excited to talk to you both.
Thanks for having us.
Yeah, happy to be here.
Welcome to the program. Well, I'd like maybe in a couple of brief sentences to introduce your first moment when you kind of realize there's a problem in your skin and the timing to which you actually received the diagnosis. There's a lot we can talk about, but I think for some of our listeners who are not familiar with the disease, they may read in a book about how it presents and how we may treat it, and we'll talk about food as one aspect of this. But the personal journey that is so impactful is often missed in textbooks and blog posts, etc. So maybe, and I'll start with you, Jillian. Tell us your personal story to the extent you feel comfortable, of course.
Sure. So I think I first noticed having some bumps like a little after puberty, maybe like 14 or 15. So a couple years. And then I just kind of had one like in the inner thigh. It would like come and go different places. And then as I got older, they got a little bit worse. I started getting more bumps. And by this time I moved closer to Ann Arbor, Michigan for college, and luckily, when I went to seek out a dermatologist, I was next to a really good clinic, and they were able to diagnose me within a couple different visits because they wanted to see it like twice. And so I think the time between that was maybe about 5 or 6 years, or maybe it was like 7 because I was in my early 20s at that point.
Got it. Thank you. How about you, Christina?
I was diagnosed very quickly, which is such a blessing because I know on average it takes patients a lot longer. But I'm in Miami, so we have a lot of dermatologists, as you know. And
Yes,
but
we do.
it was also the early 90s, so there were the treatment options available then and were not what they are today. So I remember being diagnosed, but also still being really confused about it, right? Because I was a 12-year-old and I don't even remember like the word hidradenitis suppurativa itself was like I just remember having this disease I couldn't pronounce. So there was people would ask me and I'm like,
Right.
I don't know, it's this the sweat gland thing, which is what I was told at the time. And really did not manage it well for a long time. A lot of antibiotics, which didn't leave me feeling great, and it really progressed to just very severe in my 20s. I think the college age. I think as a you get that fatigue of the wound care and the pills, and so I ignored it, which was a terrible idea because it progressed very rapidly in my early 20s. And then it got to the point where it was almost an unbearable postpartum after I had my son at 28. And I at that point I was a military spouse, and so my medical care was with TRICARE. I remember being in a military hospital, and they wanted to put me on Humira at that point, but I was breastfeeding and I was nervous about it. And so I just remember feeling really confused and not having enough resources. But this was over a decade ago. And I'm so I'm so jealous of the people who are getting diagnosed today because they have so many amazing resources. And but my HS is really well managed right now. So I'm okay now. In retrospect, like
Yes.
everyone has their journey, and I'm good now, so I can't complain.
And I think for our listeners, there's a few take homes here, just briefly, although we can pontificate on this forever. But just notice some of the delayed diagnosis, the level of confusion that our patients are going through. And then the duration of this through the lifespan, right? So we heard about starting at teenage years, but then going through college or whatever you would be doing in your late teens, early 20s, and then having a child. I mean, this disease really impacts you at the most critical years of your life. So thank you for sharing that because I think it's really important for us to understand what this disease can do to people beyond just the scarring and the pain and all the stuff that usually comes through in the research and when we read a medical journal, etc. So thank you for sharing that, and I'm sure it's not easy. So thank you. I wanted to actually now pivot towards the issue of nutrition. But perhaps a good way to do this is to for you to tell us, and anybody can go first, about your relationship with food, and and more specifically, the relationship for you with food as having HS. Has that ever come through? I mean, maybe not at all, but I know seeing patients with HS, one of the first questions I get is it something I eat? And to me, that reflects a lot of guilt and complicated relationship with food that most of us have in general, but maybe with this disease especially, there's something there. So maybe you can share some of that.
So I will say that for me, my relationship with food was managing my chest or having using nutrition to manage my chest actually healed a lot of my relationship with food because when I was diagnosed, and I was 12 years old, I was overweight, and I was told what a lot of people were told back then, which was like lose weight, wash better, which for a preteen is traumatizing. And so for most of my life, I was on and off of diets, right? I think my mom took me to Weight Watchers when I was like 8. And I had always like associated diet with restriction or being hungry or not enjoying food. But it was later in my early 30s when I started looking at nutrition for like reducing inflammation or finding if I had food intolerances, that I wasn't focused on how much I was eating, but the quality of the food. And during that journey, for me specifically, I was able to really manage my HS. I mean, it took me 2 years of troubleshooting and elimination diets and addressing underlying issues like blood sugar dysregulation and gut issues. But I was able to put my HS essentially in remission from like just not flaring at all with food, but without being hungry all the time, or I don't know, it just went from like food is only diets are only to shrink my body versus, oh, I'm using food now to heal my body. And for me that was a beautiful experience where it again it had a lot of repair, but I also understand that for a lot of patients with, you know, without access to information on nutrition, it can be extremely confusing, right?
Yeah.
I also have a background as a chef, and my mother owned restaurants, and so my knowledge of food and my access to good food was probably above average. Um, but for me, food and HS, that relationship has been positive.
Yeah, absolutely. And I think when we listen to Christina, we hear a lot of different, a lot of different concepts that come through, and at least my discussion with patients about food, and for a lot of people, you know, it's an opportunity to just improve your nutrition overall. And I love what you said about it's not the quantity, it's the quality. I love that. And the other thing I love is when you said I wasn't hungry. Which I think a lot of times, especially if there's a goal of weight loss, people go forever hungry, which is not a way to live a life. It's not a healthy way, in my opinion, to have a relationship with food. Kind of just walking around hungry. It's just not the way it should be, and unfortunately, it is true. And I've seen some publications recently, NHS specifically, that mentioned a diet, but if you read the fine print, and forget anything about the actual diet, what it is, but the fine print says that everybody on this diet were eating 800 calories a day. You don't need a nutritional degree to know that you're
Wow.
probably walking around hungry. I just, and to me, that just exacerbates that whole idea even more. So we have to be really careful when we read the literature coming out. There's not a lot. A lot of this is anecdotal, kind of case series and etc. But I think the key driving message for me and for anybody listening, if you listen to anything today, is that this is an opportunity to improve your relationship with food in general. And if HS is your motivation, great. Let's do that. Jillian, anything you want to comment on that?
Yes, yeah, this is such a great question. I'm so glad you brought it up, because I think it's easy to get into like the weeds with the science, at least for me as a dietitian, about like certain foods that might be helpful or harmful. Excuse me, helpful or harmful. And to most people or some people, that can really affect your relationship with food. So trying to reframe it as, well, I love the term food as medicine. Kind of corny and cliche, but it really resonates with me and something I think of every day in my career as a dietitian. So thinking of food as a way to heal your body, foods that make you feel energetic and give you the vibrancy that you want in life. So I think that's a good thing to think about. And I did want to share a quick story about how I first connected food with my HS. It was about, I think, 2017. We went to a dairy farm. I live in Michigan, so we have like big dairy industry here. Went with my family, and we were like doing the whole tour, and at the end, of course, we were having ice cream and eating a bunch of that and then buying like gallons of milk. And then I took the milk home, obviously, and was drinking it. And then that week, I had like the most HS flares ever. And I was like, oh my gosh, what is different about this week? And that's how I really connected. Like dairy, milk for me seemed to drive some of the HS flares.
Excellent. All right. Well, I think our listeners now are saying, all right. So I heard that this is really a terrible disease, can really impact your life and impact your relationship with food. But what do we know about what we can actually eat to improve this? And so I don't know who wants to jump in. I think we wanted to, well, let me open this up for both of you, Jillian and Christina. And what is the first thing you tell your clients when they come to you and say, "What should I eat?" How do you have a first assessment and then you kind of make some recommendations? But how do you approach that initially before prescribing a specific diet?
I know, well, Julie and I have talked at length, and when we've, every time we get together, we've always sat there and chatted and said we could talk forever about this. And we do have similarities in our approach, but also differences. I know Julian uses the MRT test a lot, and I'll let her speak to that. A lot of the clients that I've worked with in the past, because they're paying out of pocket for me as a nutritionist, and so I try to focus on what people add in before we omit foods, because there's so much focus on elimination diets, which 100.
Oh, so good. I'm sorry to interrupt you. A huge take. People take a pen and write this down because that's what I tell patients when they leave the first time. Say, remember, today I told you what you can eat more. I didn't tell you what not to eat. So
Right.
thank you. Yeah.
Absolutely.
Okay. Speak
Yeah,
that gospel.
definitely.
Speak it.
Right. A lot of people need to add a lot of nutrients in before we're omitting things, because even just adding in, more fiber-rich vegetables, more protein, more whole foods, drinking more water, we can focus on these things first before, because for a lot of people, that's going to move the needle to where they feel better without having to like omit like food groups. And a lot of people, some people do not have specific trigger foods, right? Some of us do. I know I do. Jillian mentioned she does as well. But I've worked with people who it's just blood sugar dysregulation, right? Metabolic issues driving their flares, like their inflammation, not necessarily specific reactions to food. So we can suss out a lot of that with like macronutrients intake, and also focusing on specific. So, as I'm sure you are aware, like there's certain nutrient deficiencies that we see in the HS community. So focus, like zinc is super crucial, especially for wound healing as well. So like vitamin A, vitamin C. Vitamin C is important. It's an antioxidant. It helps, with better collagen production. So focusing on foods that have these nutrients that are going to help support like wound healing and lowering inflammation and supporting the immune system first. And so I have a add in first, we'll troubleshoot and restrict down the line if needed, right? But of course, like if you drink soda, that's a number one. I also tell people, if you're drinking soda, we got to stop that now. But beyond that, I don't cut anything out at the first meeting.
Yeah, I totally agree with that. I think there's different levels. So, yeah, pretty much, Christina, we're always on this exact same page. What you just said about doing like the assessment and seeing what people are eating. I like to do like the food recall. So ask them what they ate yesterday or like a typical day for them and suggest like some swaps to get some more nutrients in. Yeah, I agree. If they're doing any sugar sweetened beverages like the soda or even juice, like things like that can really spike your blood sugar. So having them in moderation or switching to like a no calorie option for a beverage. And then I do, yeah, use the food sensitivity test kind of as like another layer down the road if somebody wants to go down like that elimination pathway.
Well, guys, just to talk a little bit more about this, first of all, I want to say I really appreciate this notion that we've got to have ways that we can have people eat. There's been a new emergence now looking at, trying to put in testing. Testing's always been a debated topic. And I know that you had mentioned, or one of you had mentioned the MRT testing. Jillian, can you talk a little bit more about that? Because with food sensitivities, and just to preface the question, we get a lot of patients that want to know, like, is there one food I can take out? And many times it's dairy, and you cut out the dairy, and it does help a lot. But even that, it's not just one food; it's like a food class. But I'm curious, people want to know: is there one food that I take out? Is there this one food that I can just remove? It's got to be a sensitivity to this one thing. So, can you talk to two things? One is, how do you bring up diet and nutrition? What's the best way to do that? Some patients, don't take well to have conversations around weight. I never bring up weight. I always bring up nutrition. Everybody wants to talk about nutrition, but I'm curious if you have any advice. And then secondly, talk about testing. How do you use testing, and how should you not use testing?
So, I think when patients come to me, they're already in like a state of readiness of change because they're reaching out to me to make an appointment. So I think it's a little bit different. How I would advise like clinicians to bring up nutrition would be like a simple open-ended question like, would you like to talk about nutrition today, or what questions do you have about nutrition? Just to see like how they react to that question, and then respecting their response. So if they're not at all interested, then okay, and you move on to something else. But if they are interested, then providing the information. And what was the second part about MRT?
Well,
Uh,
just in general, maybe even more broadly, just the notion of food sensitivity testing or food testing. How do you
Hmm.
how do you use it, and are there any sort of ways that you would recommend that people have to be careful about using it?
Yes, I would definitely recommend doing the food sensitivity test with a dietitian or nutritionist who is trained in those protocols, because at, at least in the one I'm trained in, the mediator release test, there is a whole protocol around doing it, and it's really nuanced for the person. So I don't think people should be doing them on their own, because they're also meant to be a about 6 week trial diet. Like it's not meant to be a forever thing. Same thing for like low FODMAP diets. Sometimes people will end up being on those for like months and years, and that's not how they're intended because you are sometimes eliminating entire food groups and you could have deficiencies. So I think it's definitely important to work with a professional. Yeah, while you're going through that, an elimination diet.
And kind of maybe to bounce off of that, so thanks for giving us more info on that part of it. When people do take on a diet, how do you approach it to the transition of long term? I mean, obviously there's some short term changes,
Mm-hmm.
but how do you get that to now not become a diet, but maybe a lifestyle shift for them?
Yeah, I really love journaling. It's something I recommend like every day with almost all of my patients because I think everyone has such an individual experience with things that might be feeding into like HS flares. So I recommend keeping a journal with like what you're eating, with your HS symptoms, and even like exercise and stress and other things that may impact it, and hormones especially. I'm thinking of that postpartum period too, Christina. My postpartum period was
Right.
wild. Yeah, I was like in and out of the dermatology office.
It is
Um,
fascinating.
yeah. So basically once we go through a protocol or even just a food journaling, even if we're not doing food sensitivity testing, that whole process, the intent is to figure out like some of those I'm trying to avoid the word trigger because I've seen more research lately about like that can lead to not a great relationship with food. So certain foods or certain things that might be feeding into like inflammatory state or HS flares for this example. So once you can identify those, then that kind of comes into your long-term treatment plan. Like, okay, like for me, I know milk, if I drink milk, like I'm probably going to have a flare. So I reduce how much I'm eating. Um, and so that's how I approach like the long term. We test all these different foods and see how you react. And the goal is to identify like the widest variety possible of foods so that you can have a varied diet and still get all of the nutrients that you need for like a sustainable lifestyle. I love that word too because you can't just like hop off and on a diet and expect to have long term results.
Thank you, Raja. I think this is such a challenging transition, right, from the diet to a lifestyle. So I think it's a challenge we probably all go through, even if it's not nutrition, just any lifestyle modification we try to work on with our patients. And so thank you for sharing that. I wanted to, for some of our listeners, I want to put a disclaimer out there uh, because I think some of the data is not clear, right, specifically in HS. But the low risk of adding certain foods and maybe very temporarily under the supervision of a professional, maybe removing certain food for a short duration, as you so nicely described, may have a benefit and very, very low risk compared to the other things we're doing. So I think to me, this is very easy, low hanging fruit to try to address. And patients are really, really, really care about this. We mentioned you mentioned both actually to remove the sodas. We mentioned sugar. Perhaps one of you can tell us why is it so important to have regular blood sugar, specifically in HS, if there's any evidence there. And then the second part of this, do you utilize a glucose monitoring? Because now we have new technology and people are using that all the time. So, why is it important? And do you monitor with this long term glucose monitors?
Absolutely. So there's a lot of literature, I believe, in this arena. I mean, insulin resistance is so common in HS, right? I mean, one study found like 43% of HS patients had insulin resistance versus like 16% of like healthy controls. HS patients are at higher risk to develop type 2 diabetes, and we have like elevated fasting insulin like compared to, normal people or people without HS. So we see a lot of metabolic disorders within the HS community. Then furthermore, the high insulin can drive high androgens, and the high androgens, have the whole effect on like sebum oil production, hair follicle inflammation. And so, which is, of course, spironolactone and et cetera, and metformin are also often used with HS patients. So but diet has such a big impact in this arena. So this is somewhere where we nutrition changes make such a huge difference for people, and so does low hanging fruit, right? Like you said, like it's something that immediately sugary drinks. Those are something that people just suck down. They're going to have a huge huge glucose response. And so, which is why I think they're one of the first things to change. But of course, adding in more fiber, adding in more protein, can also help stabilize blood sugar. And I do think continuous glucose monitors or glucose monitors and just the regular ones, about, the prick the finger, can be extremely useful for people. But I will say that HS patients have a sense of overwhelm. People with chronic illness have a sense of overwhelm already. So sometimes adding in like the gadgets or the tools or like too much information can be overwhelming. So it depends on the person. And I think you kind of have to gather that. I know, I'm sure Jillian does this with their clients. You can kind of get that sense of where a client is with their bandwidth for these kinds of things. I also try to have them learn themselves, know your body. Like Jillian mentioned earlier, you should feel energized after meals. When I ask people, I'm like, oh, well, how do you feel after you eat this? And they're like, well, I need to take a nap. I'm like, great. Well, that shouldn't happen. So if let's just try and change your macros a little bit and see if you feel energized after meals as opposed to being tired. Or if you can go 3 to 4 hours without eating, without getting hangry or shaky. And you try to teach the clients that how to know their body, of like knowing when their blood sugar is crashing and what that feels like, so that they can that I think that helps build sustainable change and like lasting habits.
Yeah, I want to jump in there and just talk about this because this is a space that's evolving. It's not taught well in med school. And Christina, you really nailed it. This whole concept of insulin resistance. We've been so focused on glucose and we kind of missed the ball because a lot of us look at glucose monitoring is great. But thank you for also pointing out that maybe it might be like for some people too much info. I get this actually as a response from my patients too. So really appreciate you sharing that. As a clinician, I think we've now kind of said, okay, hemoglobin A1C gives you an average kind of spread, but it doesn't really give you that early window into insulin resistance. And so the simple thing that now we're moving towards, and I know that I do this a lot with patients, is to measure, and I want to make a comment on this for any of you listening, fasting insulin, fasting glucose. And if you do the two together, you get a HOMA IR, which is so easy to calculate. They have online calculators once you get those two. And you can really tell, are you pumping out a ton of insulin to keep your glucose under control? Or are you someone that only has to put out a little bit of insulin? And it's the only measure that's simple enough. I mean, there are other ways to measure, but it's simple enough from a standard blood test where you can see that. I do this with my HS patients because then we have a target from where we're starting from. And I see this in all of dermatology. Actually, 50% of the general population has fat in their liver, intrahepatic fat, not fatty hepatitis. I'm not making any comment on obesity here. It's just even like normal BMI folks, people that are Asian descent, Indian descent, maybe even Hispanic descent. They have a higher risk for having fat in their liver with even the smallest of gains of weight or the smallest of carb loads or whatever it is. And so it kind of pulls together all of these concepts of sugar, if you have too many simple carbs, if you're not eating enough protein. So that's something that I just want to put forth that is a new measure. And boy, Christina, thank you for measuring the androgens. They've shown now if your insulin is high, not just to lower your blood sugar, but if your insulin is high, you will stimulate the release of testosterone and DHT from, in women, for example, from the thecal cells, which is just mind-blowing because we used to think insulin only existed to lower glucose. And now we're like, wait a minute, insulin resistance has all these downstream effects. So thank you for pointing that out. And then, tailoring the diet towards that would be awesome. But just to hear you talk about it as a patient, sometimes it's like, if you struggle with the disease, you will figure out the research that was hidden from us in the medical space. So I really appreciate it.
Yeah, absolutely. I also think that the conversation around HS as an inflammatory disease, like especially like a systemic inflammatory issue versus just a skin condition, is helpful for that mindset shift. Because when you're able to explain to your patients, and when I talk to people with HS, and I'm like, it's not just your skin, like you're dealing with systemic inflammation. Think about what else it affects, right? Because I'm sure both of you see this in the clinic all the time with your patients, where you see them, they're dealing with other issues, right? They have brain fog or joint pain or fatigue or a slew of number of other issues, like or other just weird skin stuff, right? It's never just the HS, and it's all a result of that inflammation. And so HS patients, we have to be on this like defensive all the time, like we're lowering inflammation. Like our default is unchecked, like super high inflammation, and we have to constantly be battling that. And nutrition can be such a tool for that. But switching the conversation when it comes to food from weight loss or obesity to managing inflammation and blood sugar regulation. And that blood sugar regulation connection, I think, is really important info for mindset shifts from the patient perspective.
So I want to stay on this, Christina. Thank you, because one of the common questions I get, I don't know about you, Raja, is anti-inflammatory diet good for me? And perhaps you can explain what does that mean, anti-inflammatory diet, and then if there's anything specifically you can suggest for people with HS.
I think, and like Jillian will, I 100% agree with this. Anti-inflammatory diet means a lot of different things for a lot of different people, which I think is the problem.
Yeah.
If you just tell someone eat anti-inflammatory, they're going to go online and they're going to see a number of things. Um, I will say that I
We
always,
need to have you both on much more. Thank you, thank you for saying this. When my patient tells me I'm on an anti-inflammatory diet, I know they're trying, and and I'm like, well, what does that mean? You know,
right.
so I didn't want to jump in on you there, but it just resonated so
Oh,
deeply.
for sure. I mean, listen, my mom was a health nut. I grew up eating like whole wheat pasta and salad with every meal, but I still developed HS and I was still flaring. And for me specifically, the way that I was eating wasn't working for my body. And it's interesting because every time I tried to eat healthier, I focused on eating more vegetables, especially lower carb vegetables. So I used to eat sheet pans of roasted eggplant and roasted bell peppers. Well, guess what? I react to nightshades. So I was making my HS worse and I didn't know it. So, Jillian's approach of journaling is so on point. Her approach, even with further troubleshooting down the line, every HS patient has their own secret sauce. There's no one fit diet, like one size fits all approach to nutrition and HS. But I think that the blood sugar regulation piece is big and affects most of us. And of course, more whole foods, more water, great. But beyond that, the journaling, that customized approach of everyone figuring out what works better for them and their tolerances. For example, I mean, Jillian mentioned dairy. Dairy makes my psoriasis flare up, but not really my HS unless I eat it a lot. So Jillian, I think you can jump in here in terms of, what anti-inflammatory means for you, but I know that it's different, right, for everybody.
Yeah, yeah. One big thing I like to talk about is fiber. And I think a lot, I'm laughing because I feel like this always comes up when we talk about nutrition for HS. Um,
Yes.
and and fiber is anti-inflammatory through the effects of the microbiome. So, one method I recommend to a lot of people is I just call it like the healthy plate method or like low glycemic, like healthy blood sugar plate method, where thinking about your plate, you make half of what you're eating non-starchy vegetables, a quarter of the plate carbohydrate or starch, and a quarter of your plate protein. So that way you're really having that balance um, with the fiber from the vegetables, and you're balancing your carbs with the fiber and the protein. It's always good to have a source of protein every time you're eating carbs, so that way your blood sugar response will be, instead of like going higher, it'll be a little bit lower because the protein's helping bring that down. Um, and also, having the fiber first can help with the blood sugar. This is a kind of a newer thing, I think. It's called meal sequencing, if you want to look up the literature, where having the fiber first kind of puts like a little fibery mesh in your stomach, and then that slows down how fast your body can break apart the carbs and then spike your blood sugar. So instead of being a spike, it's going to be a more like gentle up and down in your blood sugar.
Jillian, thank you so much for dropping the F bomb. Fiber is really, really key when I counsel patients because let's face it, we don't have a lot of time as physicians to do that. And so
Hmm.
we really, if I tell them anything, my trainees know. If that question comes up, and usually comes up when you're about to leave the room, I'll give them a bit of counseling. I'll say, here's your homework for next time. Go find kohlrabi in your store and come back to
Yeah.
me. And that starts a whole journey. And by the way, food sequencing, we had, not to show off, but we had this a couple of years ago. There's an episode on food sequencing that you can listen to in our podcast. So definitely key. I totally agree with you. So if I heard from you correctly, the answer is to what is an anti-inflammatory diet. It's not a specific diet; it's a goal, and you should for every
Hmm.
person it may be a little different, and like anything when it comes to really lifestyle change, it's a process that you have to go through. I want to this concept kind of came up a little bit, but perhaps you can discuss the issue of nutrient density Because you mentioned fiber is one of the key foods, and so how do we balance the certain key foods that are relevant? So, what are those key foods, and what do you mean when you talk about nutrient density?
I think that when you're well, we talked a little bit about like too much information earlier, and I think that that can be a thing with a lot of with again with patients. But people are starting to understand. Jillian mentioned food is medicine, and I think when people start looking at what they eat as like affecting their health on like on a cellular level, it changes the way you look at food. And so understanding that protein isn't just protein, beef has micronutrients as well. Oysters, salmon, you're going to get so much more out of certain foods than just getting protein. So, for HS as well, of course, getting more omega 3s in the diet. So including more fatty fish, different types of protein, having more vegetables. You want that vitamin A, you want that vitamin C, you need all the different minerals. So the nutrient density is eating in a way that you're getting all your vitamins and your minerals which are necessary, because when you have chronic illness, nutrient deficiencies do play a role in inflammation in your body as well. And we also have to give our body the tools to heal, especially for tissue repair when you have wounds like so many of people with HS do. So understanding that an easy way to tell people is like eat the rainbow, right? Instead of overthinking. And I love that you tell your patients to go find kohlrabi, but the average American is probably eating the same two or three vegetables on repeat. And so
Yeah.
having that diversity of eat seasonally, eat different colors, like try sweet potato, um, and different.
Yeah, and I agree. And I actually use this as an exercise to introduce them to that part of the store. They usually don't go there. And I usually will tell them, at the end of the store, there's a mysterious place.
All the
It's
produce.
There's
Well,
all kinds of
can I
greens in the
jump in and ask
dark.
a question here, Hadar, too, to both of you, and maybe
Yes.
I could direct this one towards, well, either of you can answer. Vegan sources of protein. What is your favorite? Because there's going to be a full, or vegetarian sources. There's a whole gamut of folks out there. So I just want to get a sense of, what do you tell your vegan patients or vegetarian patients?
I tell them to stay away from the fake meat, like no, beyond meat, that kind of thing. That we want to focus on, good quality tofu and legumes.
Hmm.
Pumpkin seeds are great because they're really high in zinc. And a lot of people who are vegetarian or vegan will need some level of supplementation, usually with B vitamins like B12 and maybe zinc, depending on what they're eating. They'll probably need to add in like algae sources of omega 3 as well, because
Yeah.
even with the chia seeds and stuff, like sometimes like the trend, the ALA to DPA and EHA isn't as great. So um, it's a little trickier, I think, because for a lot of junk food is vegan. Oreos are vegan, Doritos are vegan. Someone just because someone's vegan doesn't mean that they inherently eat healthy. So making sure that they're doing like a whole food plant based diet.
Yeah, you know what? We definitely need to bring you guys back, because this is like exactly what I tell people too. This is so awesome. Yeah, I mean, a diet on its own isn't healthy. It's just how you do it. And just because you give it a name doesn't make it healthy. And thank you for pointing out that ALA to the SDA transition is the rate limiting step in omega 3 that we have to overcome that. And the two sources now that we know of are algal oil, like you said, for omega 3s, and then the new one that's kind of emerged is ahi flower oil. That's emerged. That deploys more SDA. But regardless, yes, that is exactly what I was looking for, is just to get your sense of other sources. And yes, Oreos are vegan. Oh my
Yes,
gosh, so
crazy.
awesome! I love that you mentioned
Those
that.
coffee mate, which is just like emulsified oil and sugar. I mean, there's so many staples in the American diet, or just which people have normalized, that I see them and I'm like, oh my gosh, it's not really even food. So I think that a re kind of retraining our brains to the people think, well, what am I going to eat if or I have no idea what I'm going to eat if you just take out certain processed foods, because like like our left said, people are not they're not familiar with their produce section, or their butcher, or whole food like grains and legumes. And we really need to get people comfortable in the kitchen again, like less DoorDash, more cooking.
Well,
Yes.
I think on that note, I want to wrap up, but definitely agree with Raja that we need to have further discussions here. I told you, you bring these two topics to the podcast, we are going to have a good one and a long one. So, listeners out there, you got what you asked for. Before we head out, I just want to thank both Jillian and Christina for really helping us understand some of the myths and some of the important things that folks with HS, but sounds like beyond, can really do with their diet and their relationship with food. I think one of the things we took from this, at least I took from this, is that journaling or monitoring or whatever it is you're doing kind of gives you as a person feedback on what you're actually doing, kind of puts a mirror to reality. And now you're more aware, and this is definitely the first step for that long-term change of lifestyle. So at least that's one thing I took from this. And before we let you go, if you don't mind, maybe perhaps give a plug to where people can find you, because I think one of the things we also learned here is that it's always great to have a professional nutritionist, dietitian work with you, at least in the beginning. It's kind of like having a personal trainer in a way. So let's start with you, Jillian. If folks with HS, without HS want to find you, how can they find you?
Yeah, so I have a private practice that's completely virtual, so all video visits. It's called Embrace Health Nutrition. So you can find my website. I have Facebook and Instagram, although I'm not very big into the socials, I'll be honest. And I also recently got credentialed through Fay Nutrition, which is a platform that can bill insurances. So I've been super excited about that.
Fantastic, and we'll definitely put some of this in the description of the episode. How about you, Christina?
So I have a website called Nutrition for Hidradenitis Suppurativa, where I have like some articles and like digital products. I also have my cookbooks, which are available on anywhere books are sold. I don't have a practice any longer because I am full time with HS Connect. But through HS Connect, it was one of our with our many support groups. I am now we have an Inflammation Nation, which is monthly like nutrition coaching, group coaching style, and it's free. So for HS patients who just want to come to a group to kind of get these nutritional pearls every month and get a little bit of support, Inflammation Nation through HS Connect is monthly and it's free to join.
There you go. And HS Connect, easy to find. It'll lead you to good places from that website. Okay. Well, ladies, thank you. This was an excellent discussion, and I'm going to go have a healthy, well-balanced meal right now. Thank you
Amazing.
very much.
Anti-inflammatory, Hadar. Anti-inflammatory.
Yes, of course. Thank you.
It was a pleasure. Thank you.
Thank you for tuning in to the Learn Skin podcast. We hope you enjoyed today's episode and found valuable insights to take away with you.
And before you go, we'd love to ask for your support in helping us reach even more listeners just like you. Leaving a review on your favorite podcast platform not only helps us improve, but it also boosts our visibility and helps others discover our show.
So, if you found this episode helpful, inspiring, or thought-provoking, please take a moment to leave a review and share your thoughts. Your feedback means the world to us, and it truly helps us grow.
Thank you again for being a part of this journey with us. And until next time, stay curious.